Peace be upon you. I'm so sorry, long time no speak. And also, we are so sorry for today. We'll talk about a negative aspect, medicine in Yemen, a tragic story. So, medicine in Yemen has become a tragic story that many citizens experience on a daily basis. People often complain about the healthcare system and everything related to it. As entering a hospital sometimes feels like the beginning of a slow countdown to death rather than a path to recovery. One of the most serious problems is misdiagnosis. When a patient visits a hospital suffering from an illness, they are often confronted with multiple and conflicting diagnoses. One doctor claims the patient has a certain disease, another denies it and suggests a different one, while a third rejects both opinions and presents yet another diagnosis. As a result, the patient leaves confused and frightened, facing diseases they never expected. This raises critical questions. Do doctors generally differ in diagnosing the same condition? Okay. Is there a gap in medical education from one doctor to another? Or do some doctors seek personal recognition by discrediting their colleagues instead of prioritizing the patient's well being? Are we living in an era where experiments are conducted on humans, or have we simply lost our concern for human lives? Another alarming issue is the lack of medical competence in treating diseases that are considered routine in many other countries. For example, diabetic patients often suffer unnecessary amputations due to poor medical decisions. In many cases, doctors gradually amputate limbs instead of exploring alternative treatments, which severely affects the patient's psychological state and ultimately leads to death. I was told the story of a man whose leg was amputated piece by piece in Yemen. When doctors decided to amputate the second leg, his son refused and took his father to Jordan. There, after simple treatments, the remaining leg was saved. The man later expressed deep sorrow for the leg he lost in Yemen, believing that if he had traveled earlier, he would have saved both legs and lived a normal life. This is actually our situation, so we have to be patient. There are also diseases that doctors fail to treat properly, such as blood clotting disorders. In such cases, patients are often given sedatives and left to face death. This has created a sense of hopelessness among patients, despite the fact that these conditions are easily treatable in countries like Saudi Arabia, where they are considered as minor as common cough. These failures raise concerns about medical education itself. Are medical colleges producing competent graduates based on merit and high academic standards? Or are some students entering these institutions through financial influence despite poor qualifications? Furthermore, where are honesty and professional integrity? Medical errors such as leaving surgical instruments inside patients' bodies, administering excessive anesthesia that leads to death, removing the wrong organ, or improper surgical stitching have become disturbingly common. In contrast, advanced countries treat such errors as serious crimes that result in legal punishment, financial compensation, and suspension of medical licenses. Numerous international examples highlight this difference. In Germany, a woman underwent caesarean section and later suffered severe pain and fever. Doctors discovered a large surgical gauze left inside her body. The court ruled this as a major medical error, awarded her significant compensation, and suspended the responsible surgeon. In Florida, a surgeon mistakenly okay, removed a healthy kidney instead of the diseased one due to misreading a CT scan. The doctor was suspended and the hospital revised its procedures for reviewing medical imaging before surgeries. In another case, a child died after receiving inappropriate medication due to a doctor's failure to properly examine him, resulting in a long investigation and suspension of the responsible physician. Beyond medical errors, unethical practices are widespread. Doctor-patient relationships have shifted from human care to financial transactions, with patients required to pay for every visit, even follow-ups. This is our situation. Patients often wait in long lines, arriving early from distant areas, while doctors arrive late or postpone appointments. Some doctors redirect patients to private clinics to increase personal income. Others make deals with pharmacies to prescribe expensive medication in exchange for commission. Despite the availability of cheaper and equally effective alternatives, in some cases, unnecessary medications are prescribed altogether. Hospitals themselves suffer from severe shortages. There is a lack of qualified specialists, essential medical supplies, and trained personnel to operate medical equipment. I personally witnessed a patient ready for a simple surgery, but the hospital lacked anesthetic drugs. A video was recorded asking wealthy individuals to donate the required substance, which had to be brought from a city 18 kilometers away. Medical equipment is often unavailable, forcing patients to seek X-rays and examinations elsewhere. Additionally, poor behavior and lack of compassion among some medical staff worsen patients' conditions. Patients come seeking relief but leave physically and emotionally exhausted. They pay large sums of money hoping to be healed, not to suffer further. Pharmacies, especially those near hospitals, often inflate medicine prices. Some medications provided free to hospitals are illegally sold at high prices, placing an unbearable burden on patients. This situation raises a painful question. Okay, have honesty and sincerity disappeared from our hearts? Have we forgotten our moral and religious responsibilities? Have we forgot that we are Muslims? Okay, do you forget that you are Muslims? You are Muslims, remember. There are countless negative aspects within the medical system that could be discussed, but this overview is sufficient. Ultimately, if our country seeks development and progress, it must focus on two essential pillars: education and healthcare. Education and healthcare. Success in these two fields will lead to success on all others. Thank you.